Guys, and welcome to this very short dissection video where we're going to show you the femoral triangle and its contents as well as the boundaries. Right. So this here is our sartorius muscle. Remember, the sartorius muscle will originate from the anterior superior iliac spine. It's going to insert on the upper medial aspect of the tibia. This sartorius is our lateral boundary for the femoral triangle. In particular, we are concerned with its medial surface. Right. Then on the other side, they will have the medial surface of your adductor longus, and higher up here, unfortunately, cut would have the inguinal ligament. Right. And if you lift the contents of this femoral triangle, you're going to see a muscular flow there. Right. So it's a gutter-shaped muscular flow, which is made up of the iliacus, the psoas major, the pectineus, as well as your adductor longus. And content-wise, what we can appreciate from this is the most lateral structure here, which is outside of your femoral sheath, which is going to be the femoral nerve. And we can appreciate that in this region, the femoral nerve would divide into an anterior division and a posterior division. Remember, your anterior division will give you muscular branches for all the other muscles of the anterior compartment except your quadriceps. It's also then going to give you the medial cutaneous nerve of the thigh as well as the intermediate cutaneous nerve of the thigh, whereas this posterior division will then give a branches for your quadriceps femoris, which is made up of rectus femoris, the vastus intermedialis, the vastus lateralis, as well as the vastus medialis. Then it also gives you a cutaneous nerve, which happens to be the longest cutaneous nerve in the body, which is your saphenous nerve. Right. Then going more medially, these structures which are initially enclosed by a sheath, which is your femoral sheath, you expect to find the femoral vessels. So you're going to have a femoral artery and a femoral vein. The vein being more medial and the artery being more lateral. Right. So this here will be our vein, the one that is more medial. Right. Then this that is more lateral, that's your femoral artery. And we can appreciate here that on its lateral side, gives a branch, which is this one, which is going to be your profunda femoris artery. Remember, the profunda femoris emerges on the lateral aspect of your femoral artery, then courses below it to go medial, because it's going to give branches for the medial thigh, which is your medial and lateral femoral circumflex arteries. And it's also then going to continue to the posterior thigh to give you the first perforating, the second perforating, the third perforating, and the fourth perforating arteries. Right. Then in an intact body, this femoral triangle is then going to have a roof, which is skin, superficial fascia, and deep fascia. And most importantly, within the deep fascia, you find the saphenous opening, which will permit branches of the femoral artery which are superficial. For example, superficial circumflex, iliac, superficial epigastric, and superficial external pudendal, to gain access to the superficial fascia, as well as to allow your great saphenous vein to drain into the femoral vein. Right. So that's just about it. Thank you.